Good evening. Thank you for joining me, and looking forward to a presentation here that I think will be beneficial for you and perhaps family and friends as well. We're going to talk in great detail about all the causes and treatments for dry eyes. So there's several things that we're going to cover. One of the things we want to address is what are the most common symptoms of dry eyes. We listed here most of the common symptoms that dry eye patients will experience. But believe it or not, dry eye sensation is later. The first sign of dry eyes that I have in bold there is loss of focus. You'll be looking at your computer, reading a book, watching a TV show, and it starts getting fuzzy after a while. You can't maintain a clear focus. So the first sign of dry eyes is visual disturbance. As the dryness gets worse, then you start feeling the dryness and grittiness and burning, redness, irritation, etc. So very often patients will have the dry eye problem but not be aware that that's what's causing them to have trouble focusing. So who has dry eyes? So in the old days, we used to think that dry eyes was a patient, dry eye patient was typically an elderly lady, postmenopausal. That's what we were taught in school many years ago. Well, now we know that's not the case. Very often it's younger folks in particular. A lot of that is driven by the fact that we're spending so much time looking at electronics, whether you're looking at a computer, phone, video games. One of the reasons it causes so much dryness in the younger population is, as we noted here toward the bottom of that list, is it causes a disturbance in the normal blink reflex. So instead of blinking frequently and fully like we normally would, patients tend to stare at the screen. They don't blink frequently enough, and they start doing partial blinks. Instead of shutting their eye fully and squirting out tears, they do partway. So both of those result in lack of tear production. Other common patients that have dry eyes is patients who wear contact lenses because the contacts suck up a lot of moisture off the surface of the eye in order to maintain themselves as being clear and comfortable. And also patients who've had LASIK eye surgery are very prone to dry eyes. So what are some of the underlying causes of dry eyes? So certainly we know that various medications can not only cause but can contribute to worsening of a dry eye problem. Those include oral medications such as diuretics for high blood pressure, anxiety medications, sleep medications, ADHD medications, pain medicines, and even over-the-counter medicines, antihistamines and decongestants that we're taking right now for the cedar. That also contributes to the dry eyes. In addition to the oral medications, there's also the topical medications, that is, eye drops that we place into the eye. Some of the glaucoma medicines can induce dry eyes as well. So we need the medicine in order to save the patient from going blind from glaucoma, but sometimes we can adjust the medications to reduce the impact on the dryness of the surface of the eye. In addition, autoimmune conditions, any type of inflammation in the body, rheumatoid arthritis, Sjogren's, lupus, sarcoid, ulcerative colitis, all of these inflammatory systemic diseases also affect the surface of the eye because the inflammation shuts down the tear production. Environment is a factor. When we're in the summer, in the heat of the summer, and we have the ceiling fans running constantly, it blows air across the surface of the eye and evaporates the tears more quickly. Now, of course, the same thing is happening right now as we go around wearing our masks. It does direct the air. It blows our exhalation up across the surface of your eye, fogs up your glasses, and dries up the air on the surface of the eyeball as well. So, all right. A few other less significant causes of dry eyes we listed here at the bottom: the gastric bypass, sleep position, permanent cosmetics. So there's a few other things that can also come into play. Patients often ask about the CPAP. Also, if a person has sleep apnea, oftentimes the breathing mask will let a little bit of air escape and blow across the eye, and again it dries the eye up overnight. So there's many different factors that all contribute to that. Now, we're going to cover a lot of information. I don't expect you to remember it all. Please feel free to go back, review the information again, share it with friends and family. But one of the key points that I do want you to take away from tonight there's three key points. One is, again, inadequate blinking, either not blinking frequently enough or not blinking fully, prevents the eye from secreting tears, so that makes it more dry. Second, if the tear glands themselves are clogged up, dead skin cells, dried mucus, makeup, crud basically accumulates in the gland and plugs it up, and then the tears cannot get onto the surface of the eye. The third key thing that makes them dry is if there's inflammation. As I mentioned earlier, with any kind of autoimmune condition, you're going to have inflammation. You also have inflammation from external irritants. If you have a cedar allergy or you're allergic to dogs or pets or something, all of that inflammation on the surface of the eye also shuts down the tear production. So those are the three key elements that are relevant when we're talking about dry eyes. So what is the purpose of the tears? Why do we even have tears to start with? So one of the key reasons is to lubricate the surface of the eye. You need to have that surface wet and moist in order to stay clear and comfortable. It also brings nutrients to the surface of your eyeball. The cornea, the front surface of the eye, is unique in the body in that it has no blood vessels whatsoever. It is what we call avascular. So that means all of its oxygen, all of its nutrients that the cornea needs to stay healthy comes through the tear film. So that's critical. Also, as we talked about earlier, when you have a nice healthy tear film, you can hold a really good clear focus on things. Also, all the dust and contaminants in the environment, with a good healthy tear film, the tears will trap that dirt and dust and contamination and wash it away so that it does not cause an allergic reaction on your eye. And lastly, the tear film contains enzymes that kill viruses and bacteria to help prevent your eye from developing an infection. So there's two types of tears in general that we want to address. One is your natural tears, and the other is artificial tears. So very often when we're treating patients, we'll tell them to use artificial tears, which are essentially salt, water, and sometimes some other lubricants in there, but it generally also will contain a preservative, and that is just to kind of wet the surface. But it does not have the natural enzymes, the natural oils, and the mucin, which holds the tears together onto the surface of the eye. So the natural tears your eye produces when you blink has much, much more nutritional value than the artificial tears that you put in from the store. Okay? Also, there's two key types of tear production. There's basal tear production and then reflex tears. So reflex tears are the tears that your body produces, your eye produces, in response to some type of stimulus. Usually it can be an irritant. For example, you're cutting onions, the fumes get up into the eye, irritate the eye, and produce what we call reflex tears. Or you're watching a sad movie, you get emotional, you produce reflex tears. Or a speck of dust blows into your eye, you're outside and just throw some debris, your eye is going to produce reflex tears to try to flush out that debris. So reflex tears are produced through an entirely different mechanism than the basal tear production. The basal tear production is what we want to address here, because the basal tear production is what you're doing right now as you're sitting there looking at the screen throughout your day, just blinking in a normal manner. So the basal tears are what we want to address because that is where most people are deficient. So again, there's two main components to the tear film, and therefore two different types of dry eyes that a person can have. One of them is called evaporative dry eye, which is lack of water. The other is what we call lipid deficient or mucin deficient, which is lack of oil. The tear film actually has two primary components, and I'm going to jump forward. Here we go. So if we look at the front surface of the eyeball, the tear film has the very outermost layer, which is called lipid. The lipid is the oil that holds the tears together. Below that thin layer of lipid is a thick layer of water called aqueous. The aqueous is most of the volume of the tear film. It's a big, thick layer of water. Okay? At the very bottom is a layer of what we call mucin. Mucin is what sticks the tears to the surface of the eye. So you have a thin layer of mucin, a thick layer of water, and a thin layer of oil at the top. So in the old days, we used to think that if a person was deficient and they had dry eye, it's because they were lacking water, because it's mostly water. However, newer studies show, and I'll go back to where I was here earlier, newer studies show that 80% of the time, if a person has dry eye, it's because they're lacking the top and bottom layers of oil, because that's what holds all the tears together and holds it onto the surface of the eye. Right? I think I skipped one here. Go forward. Okay. Oh, here we go. So we talked about the tear film on the surface of the eye. Well, where do the tears come from? So the tears are secreted by the lacrimal glands, and specifically meibomian glands, that are in the top and bottom lid. So you have about 20 to 25 tear glands up here in the top and down here in the bottom as well. And every time you blink, it squirts tears onto the surface of the eye. Now, that's why that blinking mechanism is so important. That's what actually secretes the tears. When the lids make contact, squirts tears. Now, where do the tears go? Some of the tears evaporate into the air, but most of them drain out through the drainage tubes here in the corner. You have a little tiny hole here and here, and another one up at the top on each edge. Now, the tears drain out through those tubes. From there, they go down to your nose and down to your throat. And that is why, when you cry, your nose runs, because all the tears are streaming down to your nose, and then from your nose to your throat, and you cough because all the fluid is going down that tube. Right? Now, that's the natural drainage mechanism. Now, sometimes we can close that drain up to try to help keep your eye a little more wet, and we'll talk about that. But it's important to understand, again, the tears are secreted when you blink, and then they drain out through this drainage hole, okay? Now, up in the corner, you can see in the little diagram, but in the corner there's another kind of oblong-looking gland way up in the corner, and that's called the lacrimal gland. That lacrimal gland is the one that makes the reflex tears. Again, when you cry, something gets in your eye. So that is an entirely different gland, and that is not associated with the basal tear production. The basal tear production, which is what's in the lids when you blink, is where people have chronic dry eye. All right, so we talked a little bit about the tear film and the meibomian glands, which again are in the top and bottom lids. They're those long, kind of stringy looking things that open up right on the edge of the bottom lid and right on the edge of the top lid. Now, when you're born, you have again about 20 to 25 glands. You do not regrow new glands. You only have that number when you're born. That's all you have to last your entire life. So we want to make sure those glands are producing a good quality and quantity of tears. Okay? So one of the things that we mentioned was the blinking, how important that is. So in just a moment, we're going to run a video that shows you good, healthy blinks and a good, healthy tear film. What you'll notice, we can go ahead and start that. So what you'll notice is that top lid will come all the way down, make contact with the bottom lid, and when it does, it's going to squirt out a little bit of oil. And then when the eye opens, it'll spread that oil across the surface, and almost like an oil film on the surface. You can see the little slick of oil. And that is ideal blink, ideal healthy tear film. That's what we want. It's not running on this side, but it's showing there. Okay, good. All right, so. Oh, now it's on. Okay. Very good. Beautiful blinks. Nice, healthy tear film. All right. So let's take a closer look at those meibomian glands, the ones that make the tears. So if we look at the very enlarged view of the edge of the eyelid, the bottom eyelid, if you look closely, you can see little pink circles, little oval-looking things. And those little pink ovals along the bottom edge of the lid are the openings of the meibomian glands. So those have oil in them. It's a little bit hard to see, perhaps. You can blow up the image, but you can see little bit droplets of oil in each of those little glands. That's the good tears that we want, okay? Also, you'll notice the eyelid has good, healthy lashes growing out of it. It's a good, healthy surface. Now, contrast that with this next picture in the top corner where it shows an eye that has blood vessels along the edge of the lid. So little abnormal vessels grow on the edges because of chronic inflammation, and that can also damage the eyelash follicles. And so you'll notice some of the lashes are missing on that diagram, and the lashes that are there are going in all different directions. So some of these subtle things that we look at the eyelid through the microscope tell us that this has been a chronic condition. And that's very common, that we see patients that have actually been suffering with dry eyes for many years, and we can tell because we see this scarring and damage to the eyelid margin and to the tear glands themselves. Okay? Right. Now, if we can blow this up. So what we're looking at here is an infrared picture of those tear glands. I mentioned the glands up at the top and bottom lid. So we like to take pictures of those glands so we can see, are they healthy or is there some damage or scarring that's occurred? Well, it is certainly possible to photograph the top lids as well. It's a little bit uncomfortable for patients, messes up the lady's makeup, so typically we just do the bottom lid because that tells us what we want to know. So the picture is taken by pulling the bottom lid down, and we photograph the inside surface of the eyelid. That's where those glands are. And when we look at that with this infrared camera, it's a black and white picture. The white little stringy looking things look like little caterpillars all along inside that bottom lid. Those are the meibomian glands. Okay? So when they're nice and healthy, again, you see a bunch of long, straight, well-formed, very distinct glands. But when they start to be damaged from chronic blockages, then what happens is the gland will scar shut at the opening, and then the entire gland itself will start to decay. And that is shown in the very last picture. We see some dark gray area. That's all damaged meibomian glands. The bad news is they do not regenerate. That's permanent damage. So we want to certainly salvage those glands, get them all working properly, not only to keep your eye healthy, but because we cannot regrow them later on once they're damaged. Okay? Now, we've known about these blockages being part of the problem with dry eyes for many, many, many years. And in the old days, we figured, well, if we can remove some of that sludge, that's going to help the patient. They're going to get better tear flow because they're not clogged up. So in the old days, which means 5 years ago, in the old days, we would actually do a procedure called manual expression. And essentially what that is, we would take a little instrument, basically kind of like little pliers called forceps, place it on the inside and outside of the lid and just squeeze. And we could squeeze out some of the goo that's clogged up in there. It was not very comfortable. In fact, patients hated it. It was very uncomfortable. And it would only be able to remove the oil that was already somewhat softened. In other words, if it was totally dried and hardened, kind of like caulk in a caulk gun, if it dries and hardens, it's impossible to squeeze it out. So it would help patients to some degree, but rarely would they ever want the procedure to be repeated because it was so miserably uncomfortable. But I do want you to see how we did it in the old days, also because it's helpful to see the sludge that's inside those glands and why we want to remove that. Obviously, you see that white pasty stuff coming out. That's not a good healthy tear. That's this sludge, which is, again, dried mucus, dead skin cells, probably some dead bacteria. Oftentimes there's even some staph infection. Some of it is kind of a pussy discharge. So all that crud not only irritates the eye, it can accumulate on the lids and form this kind of crusty matter on the edge of the lids as well. So that's how we used to do it in the old days. I don't do that any longer. There are much, much better methods now that we can do. All right, so those meibomian glands, what happens to them? Well, again, they get clogged up, and when they do, you don't get enough tear production. It causes inflammation, it causes infection, it causes discomfort. And then over many, many years, they actually scar and die. So that's what we don't want. Now, one of the other things that is relatively new information, in other words, over the past 2 or 3 years, is we've also known about this little critter that can infest and basically live in the oil glands and the eyelash follicles, which is a relative of a dust mite. This little mite, it's called Demodex follicularum. Demodex lives in those little glands and lives on the dried mucus and the dead skin cells that are inside those glands. This is a very enlarged picture of that little critter. The biggest problem is it causes infection and inflammation, so the patients are very, very uncomfortable. We see this kind of debris, again, accumulating along the lid margins, and there are certain characteristics we look for that tell us that it's from the Demodex infestation. So we knew that those little critters were there, but we didn't really know how to get rid of them. We would try different ointments and stuff, but it never really killed them. Well, now we know that there is a way to actually kill off those little Demodex, and we'll talk about that in a second. So first, let me show you. So in the old days, when patients had this crusty debris on the lids, doctors would tell them use baby shampoo to clean the lid margins. The idea being, well, it's mild enough for a baby, it's probably going to be okay for the eye. Well, in reality, I know it's hard to read, but below the picture of that baby shampoo, we enlarged the ingredients that are in the baby shampoo. It's a bunch of chemicals that I don't think anybody can really pronounce. Point is, it's got a lot of very harsh chemicals in it, including fragrance and coloring, and stuff that your eye doesn't need. So what the shampoo does is it does clean off some of the dried mucus, but it does not kill the Demodex. Okay? It gives them a bath, but it doesn't kill them. So the only thing that kills it is either refined tea tree oil or the active ingredient in tea tree oil called terpenol. And those two ingredients are in a couple of different products, and a couple of them we show on here. One is called Blefadex, the other one is called Oust, and let's see. Yeah, those are the two main ones that we really recommend. Now, once we've used that to kill off those Demodex, which usually takes 2 or 3 weeks, then we can go back to using just a regular lid cleansing wipe. The most common one, it shows in the picture there, is called OcuSoft. They make this little lid cleansing wipe that's in a sterile little pack. And with that, you just clean the edges of the lids, flip it over, clean the other side, and then rinse it off. So that's great just to remove dead skin cells and debris. But first, if there's any evidence of Demodex, those have to be killed by using the other specific lid disinfectants. Okay? All right. Now, once we've eliminated any of the Demodex, another very, very beneficial lid cleanser, one that I use personally, that I like a lot, is called Avenova. It's a spray. And Avenova kills bacteria. In fact, it actually kills COVID virus on contact. So it's an excellent lid disinfectant to keep any bacteria from overgrowing, but yet it's not harsh or toxic to the surface of the eye. So that's an excellent product to use for ongoing maintenance to keep the eye clear of any bacteria. Right. So besides the medical treatment, what are some of the other things that you can do to help reduce your dry eye symptoms? So one of the things we kind of mentioned earlier is when we're treating patients with glaucoma, we have now the ability to special order glaucoma medications without any preservative, because every drop you put on your eye has a preservative, and those can irritate the surface. So it is possible to now, even for patients who take 2 or 3 different glaucoma drops, it's possible to have a company make a bottle of 2 or 3 drops in one container without preservative. And so if you have glaucoma, mention to your doctor that is certainly a possibility. Okay? The other is there's other ways to treat glaucoma. Sometimes surgery or laser surgery can be done, in which case then the patient may not have to use the drops. Also, there are some newer implants that are being developed. Basically, it's a little insert we put into the drainage tube, and it has glaucoma medication in it, and it slowly dissolves and releases the medicine over time. So there are some other options on treating glaucoma that can also help to reduce some of the dry eye symptoms. Other is just changes in overall lifestyle. So we know, as we said, that high blood pressure medications, anxiety medications, etc., cause more dryness. Well, if a patient is able to adopt a healthy lifestyle, obviously that means good healthy eating, stress management, exercise, and thus reduce their anxiety level and be able to get off of some of those medications, that is going to help their dry eye. Also, taking frequent breaks from electronics. We know people tend to stare. They blink 60% less frequently on the computer. So if you can take breaks from the screen, or if your job requires you to be on the computer all day long, when you get your lunch break, don't go check your Facebook. Instead, get off the computer entirely, do something totally different. Walk around, look out the window, so you can kind of get some normal blinking back on the surface of the eye. There are, in fact, even blinking apps that you can download on your phone or on your smartwatch that will literally remind you to blink. I know it sounds like something you should be doing without having to be told, but sometimes we have to retrain the eye in order to restore the blinking pattern. Let me see. And also, in order to kill both dust mites and any Demodex mites, it is also helpful to wash and dry your bedding, towels, etc., in very bland, like baby detergent, with no fragrance, no coloring, and dry it under high heat. That can help to kill the Demodex and the dust mites as well. And let's see, air filters. So especially when we have chronic inflammation, chronic allergies, whether it's from cedar, from something that you're allergic to in your home environment, it's helpful to have an air purifier. I have one in my home. We run all the time in our bedroom, and I think that does definitely help to reduce some of those allergens in the air, which can cause some inflammation and dryness on the eye. And then lastly is to be sure you're wearing good quality sunglasses, because the sun beating down on your eyelid causes the lid to thicken and scar. If you think about, if you see an old rancher, the back of their neck, the skin is thick like leather. The eyelids are not supposed to be that way. They should be very tender and nice and healthy and pink color, not scarred and thickened. All right? So those are some helpful things that you can do on your own. Yes, the question.
One lady asked, could you list the name of the chemical that kills Demodex?
Yes. So the chemical that kills Demodex is called terpenol, Terpinol, and that is the purified active ingredient in tea tree oil.
And the next question is, can your eyes still feel dry even after a long good blink?
Yes. So the blinking is one of the three parts to having a good healthy tear film. So even if you are making good blinks, if you have inflammation or if you have blockages, you're going to still have dryness. So the blinking is one of the three elements we need, but oftentimes we need much more than just that.
Okay, and then last question is,
One more question, yes.
does wearing glasses that block blue rays help?
Right. So the question about Blu-ray protection in your eyeglasses, especially on the computer, has not been shown to be relevant to dry eyes. It doesn't make it better, it doesn't make it worse. In general, most doctors do recommend to have that blue wavelength protection in your glasses, but it is not directly a factor in the dry eyes. So thank you for those questions. All right, so now we're looking at a very colorful slide. These are some of the diagnostic tests that the doctor does through the microscope to tell, do you have dry eyes, do you have an infection, is there something in the eye, what do we need to do? So those bright colors are the yellow dye, or sometimes use a green or a red dye to show us what areas have tears and what areas are too dry. I don't know if we can blow up that second one, the green, and it'll show, yes, okay. So right there where it says tear breakup time, that picture in particular, you see there's some dark areas and some kind of a yellowish green area. The yellowish green is where there's tears. We put the dye in there and it stains the tears. So if we see color, there's tears. The dark area is where there's no tears. So those dark streaks at the bottom is where there's no more tears, they dried out. In addition, towards the bottom half below the pupil, you see some very bright glowing like little yellow specks. What that is the dye absorbed into the skin of the eyeball where there's broken skin. It's essentially chapped. So if you have chapped skin on the surface of the eye, obviously it feels uncomfortable, it causes your vision to be hazy, we can't get good readings on your glasses, your eye becomes very light sensitive, and that skin needs to be smooth and polished like a polished mirror to see well and to be healthy. So we put that dye in there so we can see what the surface looks like. And depending on the severity of it, that guides the doctor into knowing what treatments would be appropriate for that patient. Right. So again, we talked a little bit about inflammation as being one of the key contributors to dry eyes. So where does inflammation come from? So it can come from, again, external irritants, mountain cedar, oak, if you're allergic to dogs, whatever it happens to be. So that's one source, it's external irritants. Okay? Cigarette smoke is another big felon. All right. Second is you can develop inflammation according to what you ingest in your body. For example, you've heard of people that have gluten sensitivity, or people who are allergic to peanuts, various different products that they ingest. And your body will react to that if it's something that you're allergic to. That inflammation makes the patient ill, and again, that inflammation contributes to dryness on the surface of the eye. Why is that important? I do recommend to patients that have a lot of inflammation that they consider doing what's called an anti-inflammatory diet. And you can look that up online. There's various different versions of that, but basically it's eliminating foods that have a high likelihood of causing inflammation in your body. Essentially, it's making your body more healthy, so that's a good thing. All right. Third is you can have inflammation from your own body. Autoimmune conditions are diseases where the body starts attacking its own normal healthy cells. I mentioned a few of those: lupus, sarcoid, rheumatoid arthritis, ulcerative colitis, Sjogren's disease. There are several diseases that cause the body to have its own inflammation internally, and so we work as hard as we can to try to neutralize that on the eye because we know that contributes to the dryness. All right. So a key point is, I've mentioned about how we can see some of the damage that occurs over time. Recognize this: dry eyes is not only a progressive disease that gets worse and worse and worse if we don't treat it, but it's chronic, it's ongoing. We have to continue to be aware of it. I tell patients it's kind of like rheumatoid arthritis. You treat it, but you have to continue to be monitoring, continue to be keeping it up and keeping it healthy. All right. So chronic conditions have a tendency to what we call wax and wane. That means there'll be periods of time where it wanes, it's comfortable, you're doing well, but then very often there will be a flare-up. That's very common. So we try to keep the patient as comfortable as we can, but we know that flare-ups will occur, and if so, then we devise appropriate treatment to calm that inflammation down. Right? So there is also a type of condition where the eye itself can feel pain or discomfort even when we've successfully treated the dryness. When we look through the microscope, we see no signs of dry eyes. The best example I can give this is two things. One is a condition called fibromyalgia, where in spite of lack of obvious physical disease, patients report a lot of discomfort, a lot of pain in their body. Another example is what's called post-herpetic neuralgia, a patient who develops herpes zoster, which is shingles, and develops these awful painful sores on their face or anywhere on their body. It can even happen on the eyeball itself. And even once those lesions heal, and to look at their skin, you see nothing, they still say, I still feel pain. And the reason is the pain is in the nerve root. And so there are treatments that are being developed that we can use to help to reduce that nerve pain. So obviously, we treat the dryness on the surface of the eye first, and that usually resolves the pain and discomfort. But in cases where that pain or discomfort persists, then we target just the pain and discomfort with analgesic medications. You know, one thing that we added here not long ago is dry eye, because it's a chronic condition, has a very high incidence of depression. And this is very serious, especially for family members of the patient who suffers with dry eyes. Often, family members or friends may not take it very seriously, but in fact it is a very, very significant condition. There was even a report of a news anchor up in the Midwest who committed suicide because she had such severe, unbearable eye pain after LASIK surgery. So it is really a very significant problem. So what can we do about it? Obviously seek help from a mental health care professional, increase your social interactions. I know we're trying to socially distance with COVID, but the more interaction you can have with other people, volunteering, getting out, doing things for other people is a great benefit as well. Help with depression. That is something that's very significant. But I do want to point it out so that the patients and their significant others know that that's a very real issue. So we talked about some of these things we can do to help with the depression. So what are some of the treatments for dry eye? So the most common things that we often do is use artificial tears, as I said, to kind of wet the surface. And sometimes we'll even put little inserts in the tear drainage duct to stop up the drain. Now what that does is it holds the moisture on your eye so that it feels more wet. However, both the artificial tears and the little plugs can help you feel better temporarily, but they don't fix the problem. Remember, the root cause of the problem is you're not producing enough good quality tears. So we want to improve your own natural body tear production. So most of our treatments are emphasized towards that. So what are the things that we do? Obviously, we start out with the tear drops to wet the surface and lubricant gels and ointments. That does help symptomatically. We also will often use anti-inflammatory eye drops. The most well-known one is Restasis. It's been around about 15 years. It's a good medicine. We know how it works. We know it has a good safety profile. Or the newer version of it called Xiidra. This has been out about 3 years. And then there's another newer one that came out a few months ago called Cequa. All three of those are what are called non-steroidal anti-inflammatory drugs. They reduce inflammation, because we know that's part of the dry eye syndrome, but they are not steroids. So they are safe and, in fact, are intended to be used long-term. Okay? Now, if a patient says, well, I did well on that, but my insurance doesn't cover it anymore, now it's too costly. Well, there is a company that can, what we call compound or custom make a generic version of Restasis and send that directly to your home. So there's another way we can get medicine to patients. And in the rare case that a patient is either allergic to the Restasis or Xiidra or Cequa, we can also use other what are called NSAIDs, non-steroidal anti-inflammatory drugs. So the point is, with medication, we can reduce the inflammation. It'll help your eye produce more tears, reduce your discomfort, and again, just make your eye overall and much, much healthier. Other things that we look at is oral antibiotics. We use a lot of oral, what's called doxycycline. That is used a lot by dermatologists and eye doctors because it reduces inflammation, it kills the staph bacteria that reside in those glands, and also thins the mucus so it doesn't clog up as easily. We use it a lot because those meibomian glands, again, tend to get clogged and inflamed and infected. It's also used because it helps the sebaceous glands on the face for the same issue. When the sebaceous glands on the face get clogged and inflamed and infected, that's acne. So doxycycline is used a lot for acne and for the eyelid issues as well. Okay. Other things that we'll often use are, let's see, I'm reading from this too small away. Okay, steroid eye drops, because the steroid drops reduce inflammation very quickly. It's very common that when we're first treating a patient, we will start them on a steroid or steroid antibiotic eye drop combination. It reduces the inflammation quickly. Patients feel relief usually in 3 or 4 days. Once we get the inflammation under control, then we generally want to withdraw the steroid and switch them to a non-steroidal, like the Restasis and Xiidra and Cequa, for maintenance. Okay? But at the outset, it's very common to use those to get the patient comfortable and control that severe inflammation very quickly. Okay, there's also an oral medication that can be prescribed by a rheumatologist. There, I wrote a couple on there, Salogen, and there's similar ones that can help not only with your tear production, but also for patients who have Sjogren's, which is dry eyes and dry mouth. It can help their production of saliva. So those two are tied in because of the inflammation that affects both of them. So there are some oral medications that can sometimes be helpful prescribed by a rheumatologist. We can also use what are called autologous serum tears. And we have used those for many years. I'm using them less now because there's another newer option that I think might be better for most people. But essentially, serum tears, the doctor writes a prescription, we send you to the blood bank, and they draw your blood, spin it in a centrifuge, and all the red blood cells fall to the bottom of the test tube, and the clear serum stays at the top of the test tube. They take that clear serum, mix it with pure saline, put it in a bottle, and give it back to you. So the advantage is there's no preservative. We know you're not going to be allergic to it because it's your own body's nutrients. Okay, thirdly, it has some of the natural healing properties that are present in the serum that can help repair some of the damage on the surface of your eye. The disadvantage is if you have a lot of inflammation, some of that inflammatory cells could be in the serum, in which case we're introducing it onto the eye. The other is you have to keep going back to the blood bank every 3 months or 4 months to get more blood drawn. You have to keep the serum tears in a cold container at all times, so you have to carry around a little ice pack with you basically. And it doesn't work for everyone. But it is an alternative. Again, there's something newer that I'm going to talk about in a moment, but that is another option that we can look at. Lacrocert, I'm going to not even talk about because it's been taken off the market just as of this month. Lumify and Upneeq. So we're going to talk a little bit about that here in just a moment. And Oxybate and Regenerize. Now at the bottom of that list, I put some other things that you will find if you do an internet search for dry eyes, but these are either not FDA approved or clinically do not have studies that show that they are in fact truly effective. The only one that I will point out on there is the testosterone drops, because it's well known that hormonal changes that occur, especially in ladies, but even in men, or hormones change as we get older, a lack of testosterone can cause more dryness. So testosterone therapy, whether it's men taking testosterone supplement or women in their hormone replacement therapy, including some testosterone, can help with the dry eye. Again, that's something, of course, you would take up with your doctor as to what would be appropriate for you. A question, yes?
Yes, so the question is, somebody asked, is it common to develop acid reflux with Xiidra?
Okay, so remember we talked about how the tears drain through the tube here, down to your nose and down to your throat, and of course from your throat down to your stomach. So it's not common, but there are some people that bitter tasting medicine irritates their stomach. So for those people, what we recommend is a couple things. One is take the drop with food in your stomach, okay, like after a meal is ideal. Also, do what we call punctal occlusion. And so what that is you look up, you put your drop in each eye, then you close your eyes, you tip your head downwards, and with the clean Kleenex, you squeeze the inner corner like this for 2 minutes. So what will happen is the tears that are draining out of the eye, more of it will stay on your eye, less will drain down to your throat. So tipping your head downwards more of it will drain out your nose and less will go down your throat. Okay? If that is severe, then we will sometimes just change to a different medication. Okay. All right. So what can we do clinically? What can the doctors do clinically to help treat the dryness? So if you'll blow that up a little bit for me. So obviously we talked about one of them, which is the blinking exercises, right? So when we're doing the blinking exercises, again, we're going to make sure you're making full closure and frequently enough to pump the tears, all right? All right. Also, the warming mask. A warming mask, you put it in the microwave, not a washcloth, that's not effective. A warming mask, you put it in the microwave to warm it up, close your eyes, lay it on there, leave it on 5 minutes. That softens that mucus that's all hardened and sludged up in there, opens the glands, and then as you clean or massage the lids, it helps to dislodge all that sludge so that the tears can get through, okay? Punctal plugs, we talked about the little insert we put here in the corner. There's some that are permanent, some that dissolve. Generally they dissolve. There's the types that dissolves in 2 weeks, and there's another type that dissolves in about 5 months. But those can help hold the tears on the eye, helps you feel a little better, which I'm all for helping patients have some relief. But again, remember, it does not cure the underlying problem. The underlying problem, you're not producing enough tears, so that's what we really want to emphasize. You can also use what are called moisture chamber goggles. Now that is essentially kind of like swim goggles. They're goggles that have a little rubber seal around the edge. You put them on and it holds the moisture in there. It doesn't let any air blow across your eye, and the tears that you do have create a little moisture chamber, and it helps keep the eye like a little humidity chamber, and it does help a little bit with the dryness. Not very attractive, but in a severe case, it can be beneficial, especially if a patient travels to a very arid environment. For example, if you go on vacation to New Mexico or Arizona, where it's severely dry, it's not uncommon for patients to need to use those moisture chamber goggles. All right, these last few on here, Procera, Eclipse, Blefex, and Lipoflow, we're going to talk about in more detail. I do want to mention a few other treatments that, again, you may read about on the internet that are either not FDA approved or have not been shown to be really clinically significantly effective. I listed most of those on there. One of them I will point out is the IPL Intense Pulse Light. That is basically a laser that's used to warm up the vessels under the surface of the skin. Originally was made to treat skin discolorations, so dermatologists use that a lot. A few eye doctors, there are some studies that have shown some benefit for dry eyes, but one, it's not covered by insurance. Two, very few people can actually get the treatment without causing other discoloration to their skin. And three, it is quite costly with very low success compared to the other treatments that are available. All right. If there's any specific questions about any of these that are listed on there, please feel free to send in a question. I'd be happy to address those, okay? All right. So let's talk about Procera, one of the treatments that we mentioned on the previous slide. So what Procera is a medicated contact lens. What it is it's made out of human amniotic membrane. So from a full-term healthy baby that's born by cesarean, they take the inside lining of the placenta called the amnion. They take that tissue and make it into a contact lens. The doctor places that contact lens on the eye anywhere from 3 up to 5 days, and that amniotic tissue has the stem cells and growth factors that the baby needs to grow healthy new cells very rapidly. And when we put it on your eye, it super accelerates the healing of the dry, dead skin. Remember I showed you that picture earlier of that chapped area. So when we do the standard dry eye treatments, if that area just refuses to heal and continues to stay rough and scaly, we can put the Procera lens on there, and the studies show that 90% of the patients will get full resolution of that dry, dead skin in that 3 to 5 day period. Okay? Let me show you a little bit more about it. So again, we talked a little bit about the Procera. We use it other than just for dry eyes. We use it for severe corneal burns. We use it for cuts on the surface of the eye to try to prevent scarring. We use it for a variety of different conditions. One of the things that is especially beneficial is the last on that top list. It says corneal nerve regeneration. So I mentioned earlier that LASIK surgery can cause dry eyes, and the reason is it severs the nerve tips on your eyeball. The surface of your eye has nerve endings that sense dryness and temperature and pain. So when those nerve tips get severed, when they do LASIK, the eye gets dry, but yet those nerves don't sense the dryness, and so they don't signal the brain to produce more tears. So this dryness starts to get worse and worse and worse until the patient is very miserable. So what these Procura lens can do is it can regenerate those nerves so that they once again sense that they're feeling dry and will automatically tell the brain to produce more tear flow. So that's a beautiful thing that we did not think that was possible in the past. We thought that nerve damage was permanent. So now we have a good treatment for that. Okay. We put the lens on again from 3 to 5 days. The treatment effect can last for several months, sometimes even up to a year. It depends on the severity of the patient. It can be repeated with very good results. Each time it's repeated, it works better and better. Okay? It is covered by most insurance. You do have to know 3 things. One is you see fuzzy. It's a membrane. It's a film. So when we put that lens in, you see fuzzy for 3 days. You do feel it in there. It's not like a regular contact lens. Patients say it's a little bit annoying, but tolerable. And third, it is costly. It's about $2,500 for one lens. Insurances do cover it, subject to whatever your copay or deductible would be, but we always submit it to the insurance, and it generally is covered. Okay? All right. So here's some before and after pictures. If you hopefully it's on your left. On your left, top left corner, you see a picture of an eye, and if you notice the reflection of the light bulb there in the pupil, that light bulb reflection is very grainy. And that's because the surface is very hazy and dry and scaly. It's chapped because it's so severely dry. To the right of that, it shows the Procura lens in place, and then the below picture on the left is after the treatment. So if you notice that light bulb reflection, it's nice and clear. You can see the structure of the iris. It's a nice clear image. So it's quite a difference before and after. Okay? Now, to show you in more detail, here's another example, the top left corner, severe dryness. That cornea is all hazy, what we call edematous. You can barely see the pupil, and certainly the patient sees very fuzzy and very uncomfortable. On the right side, it shows that Procura lens. When we put it in, it's a little bit hazy, kind of like a film. But when we remove it, which is the bottom right corner, it's all opaque. It looks like it's white and milky. So what it did was it absorbed all the dead skin cells and all the crud off the surface of the eye, and in exchange put all the nutrients into the cornea. And so that bottom left corner, now that cornea is nice and clear. You can see the pupil is very distinct, the iris, that's a very clear, healthy eye. So some patients cannot tolerate the Procura. It's not common, but there's a few. So there is an alternative, and that is called Eclipse. And there's other similar brands too. But what it is, as it shows on that little picture, it's a very thin layer of a dried amniotic membrane. So they take the amniotic tissue and dry it into a thin sheet and make it into a little circle, like a little disc, and that goes inside a soft contact lens. So we take a soft contact lens, place that Eclipse membrane inside it, and then place that soft contact lens on the eye. It's definitely more comfortable than the Procura. However, the studies show it does not have as much nutritional value as the original membrane does. So we do use that kind of as an alternative to the Procura, and it does give you good results. We leave it in for about a week, and then we remove it, again, with very much the same benefits. Now, there is another newer even version of the amniotic membrane, and that is called Regenerize. Regenerize is a liquid version of the amniotic membrane. So I tell patients it's still beneficial. The advantage is you can do it at home. It's an eye drop that the company sends directly to you. So they ship it directly to your home. You put the drop in 4 times a day for 1 or 2 months. After that, you drop it down. You can usually go to twice a day, do it for another few months, and then you can either stop it or continue depending on how severe your eyes are doing. We've had very, very good results with it. Again, it's the same amniotic membrane, but in liquid form. I tell patients it's kind of like eating a pear versus pear juice. The pear still has more nutrients. The juice is still good, but we prefer the pear. So the Procura is the original membrane. The juice is the Regenerize. The other thing I like about the Regenerize is it is, of course, FDA approved. Right? They ship it directly to your home. There's no preservative, so you don't have to worry about any kind of reaction to the medicine itself. Okay? The one unique thing about the Regenerize is this company has made the decision that they do not want to accept insurance. They don't work with insurance companies. It's a cash-only medicine. It runs about $175 a month for the first 2 months, and then it goes down to half of that. So it's a remarkable product, but again, it would be a cash pay directly between the patient and the pharmaceutical company. It is by prescription, it is FDA approved, and we can prescribe that for the appropriate patient. All right. Another newer treatment called oxervate. So I mentioned earlier about the nerve damage that can occur on the surface of the eye. When we've done these various treatments that we've already mentioned, if the patient still has severe dryness and lack of nerve sensitivity, there is a medicine that is a lab-created version of the same type of nutrients that are in the Procera lens. Okay, so instead of being a natural tissue, natural biological tissue like the Regenerize and the Procera, it's a lab-created version of it. Very, very successful. I've had amazingly good results with it. However, it has to be a last resort because the insurance will cover it, and it is FDA approved, and it's been very, very beneficial, but we have to show that we failed on every other type of treatment first. And the simple reason for that is it's over $20,000 per eye to get the medication. So when it's needed, it's an excellent medication, but again, it's for a very limited scope of individuals. But I did want to let you know that is something that, and this is something that's over the last few months, became available by the FDA. Yes, a question.
Can contact wearers use Regenerize?
Yes, so the literature says that you're not supposed to use the Regenerize if you're wearing contact lenses. However, because it's a natural biological product, I would not hesitate to recommend it to a patient to use it in the morning and in the evening. Of course, do it without your contact. During the day, I would be perfectly fine with you putting in with the contact lens in place. Now, that is more true if it's a daily disposable because you're going to throw the lens away. If it's a monthly lens, it is possible it could cause some discoloration of the lens over several days of doing it. So my answer is yes, if it's a daily, I don't think you'd have any problem, but if it's a monthly lens, it could potentially discolor the contact. One more question, yes.
Go back, somebody asked what were the names of the eye washes that are better than baby shampoo?
So Avenova is the best. It is prescription, but you can actually order a small version of that online. On Amazon.com, they have Avenova that you can purchase. It's about $30. That is the best. Now, that is because it's prescription grade, absolutely pure. Now, there are other knockoff versions of it. I know the company doesn't want me to hear me say that, but they are not pharmaceutical grade. They are cosmetic grade. There's one called Hypochlor. There's 2 or 3 other. Accusin is another one. And they are also hypochlorous solution, the same active ingredient, but they're not 100% pure. So there are other options too. Okay. All right, so we talked about oxervate. Again, we're going to address the root cause of the dryness. So in the past, when we would do artificial tears and plugs, again, it helps your symptoms, but remember the root problem is you're not producing tears. So how can we treat the root cause of the problem? One of the things that we've known is dead skin cells, dried mucus accumulate in the gland and on the edge of the lid. And that all that stuff dries and hardens and forms almost like a crust. And it covers up the glands on the edge to where literally when the doctor looks at the eyelid, we can't even see the openings because there's this hard crust on there. The best example I can give you, it's kind of like on your heels. You can develop that dry, dead, callousy type of skin on the heel. The only way, even if you shower, you clean it, but you don't get rid of it. The only way to get rid of it is to scrape it off, to buff it away. Well, now there's a procedure we can do where we can actually buff away all that dry, crusty stuff off the edge of the lid margins. It's FDA approved, it's safe, it's painless. 85 to 90% of the patients get better. And that's this treatment called Blefax. And so again, as it shows in the picture there, before you see this kind of crusty debris on the lid margin, after we buff all that away, the edge of the lid is nice and clean. We got rid of all that crud. This is a short video of the treatment that I did on a patient, and I don't know if there's any volume, but that's okay. It's not really necessary. Oh, hold on.
As you go bottom.
Is it running? Okay, good. So I'm not able to see it on my screen, but if you can see it at home, that's what matters. So again, I take that little spinning tip, I put a numbing drop, I take that little spinning sponge and go on the inner edge of the lid margin, and then we reverse it, spins the other way, go again, back and forth. Then we do the top lid, same thing, reverse it, same thing, and then we do the other eyelids as well. So we do all 4 lids. The entire treatment takes only 10 minutes. Again, FDA approved, painless, totally safe. 85 to 90% of the patients get better. It is a treatment that can be repeated in every 6 months if needed, depending on how well the patient keeps that area clean. Because all that crust not only covers up the glands, remember that's a breeding food for the Demodex. So we want to eliminate all that crud off the lids. Okay? So that's the first treatment. It's called Blephx. So that clears all the crud off the margins of the eyelids. The next thing that we do is a treatment called LipiFlow. The LipiFlow actually removes the sludge inside the glands themselves. Okay? Now, the purpose of it again is to remove all that crud so that the tears can flow through, so that when you do blink, the tears just stream out onto the surface of the eye like they did in that video that we looked at earlier. Okay? So this is a picture of the actual eyepiece that we use. Basically, there's 2 parts to it. There's a part that goes under the eyelid. It looks like a contact lens. So I put a numbing drop in the eye. We place that contact lens under the lid. The patient closes their eye. And we do the same on the other side. Now, the front of it has these 2 little soft massaging cushions, and that is connected by a cord that you see in the picture there to a computer. And that computer monitors the temperature and the pressure, because there's 2 things happening. That contact lens has little LEDs so that when it's under your lid, like a contact lens would fit, it puts warming into the glands of the lid to melt the mucus. Because when it's hard and solid, it won't come out of the gland. But if we warm it up and melt it, basically liquefy it, then we can massage the lids gently and that stuff will be excreted. It will be sucked out. Okay? So let me show you a little video. So this is a video of me placing the eyepiece on a patient for the LipiFlow. So again, we put the numbing drop. We have the patient look down, place it up under the top lid, and they look up, pull the bottom lid down out of the way, and it's it. It's on. Then we take a little piece of tape and we put it across the forehead just to keep that little cord out of the way. Okay? Very simple. Again, FDA approved, safe, painless. The entire treatment takes 12 minutes. We typically do both eyes at the same time. We can do one at a time if a patient would like, but typically we do them simultaneously. It's a 12-minute process. Okay? This is a close-up picture of that eyepiece. Again, the front part where you see it looks curved, looks like a contact lens. That's the part that goes under the lid, and that's what does the warming to melt the mucus in those glands. And then the other part right above it is the soft little rubber cushions. Now, one key thing that I'll point out, this is dramatically more effective than a warming mask. And the reason is this: when you put the warming mask on the outside, the heat has to go through the skin, through the fat under the skin, through the lid muscle to finally get to the inside where those glands are, okay? So actually only about 10 or 15% of the heat you put out here actually reaches all the way into the gland. Whereas with the LipiFlow, that eyepiece puts the heat directly into the glands of the lid. But the beauty of it is none of the heat goes to your eye. It's only directed into the glands in the lid. And so therefore, it's very safe. So this chart that I'm going to show you here is actually really interesting. This is from the original FDA study when the LipiFlow was being considered by the FDA. So there's 2 charts there. You can see a group in yellow, a group in orange. On the left-hand side, running up vertically, there's a column that says tear meibomian gland score. Remember we said there's about 20 to 25 glands in the lid, so that line running up the side goes all the way up to 20. So what we did to those 2 groups, the ones in the yellow is the group that had LipiFlow. The group in the orange are the ones who did a warming mask. So they started out with very similar gland counts. I think one is 6.1 and one is 5.6. They started out with a few glands, and they were age matched. So they had the same number of people in each group, the same ages, same sex, etc. So these 2 groups, one group, the orange ones, did the warming mask. The group in the yellow did the LipiFlow. After 2 weeks after the LipiFlow, the average gland count for the group that had the treatment went up to 14.3. So it more than doubled. So now there's a bunch more glands working. Whereas the group in the orange that did the warming mask for 2 weeks, their gland score only went up by about 10%. Okay? So it's something, but not near as dramatic as the group that had the LipiFlow. If you go further to the right, where it has week 4, so 4 weeks after the LipiFlow, the number of glands that were working continued to improve. So they believe it's 16.7. So it continued to go up and up even after 4 weeks. So the LipiFlow shows that not only is it effective, it continues to get better. Now, the group that was in the orange that were doing the warming mask, obviously they were not benefiting that much. So they said, okay, if they're doing a warming mask now, will it still benefit them to have LipiFlow? So they did what's called a crossover study. So you see that little X at the bottom of that yellow box. So they took the group that was doing the warming mask and they said, let's treat them with LipiFlow as well and see what happens. So they did the LipiFlow on that group, and their gland score also went up. You can see on that last one is 11.7. So remember, they started at 5.6, and 2 weeks later, after doing the LipiFlow, they went all the way up to 11.7. So again, basically double. Okay. So the point is, the number of glands that you have working will generally increase from 2 to 3 times once you have the LipiFlow treatment. Now, what is the limiting factor there? Well, remember, at the beginning I showed you those pictures of some of the glands that have scarring. If you have a lot of dead glands and a lot of scarring, you're obviously not going to get as much improvement because a lot of the glands died. But if you still have very good healthy glands, but they're just not working because they're clogged up, then you're an excellent candidate for the LipiFlow. Okay? So, on this procedure, is it a safe procedure? The answer is absolutely. The reason it's safe is because the eyeball, which is what we call the globe, the eyeball is protected from the heat during the treatment. None of the heat goes into the eye. It's all directed into the glands of the lid. Okay? All right. Also, the amount of massaging pressure that those little cushions do during the treatment is very low. It's about 5.4 pounds per square inch. Now, the manual expression, remember I showed you the video earlier where we were squeezing the lids? Okay? That is about 30 pounds per square inch. So that's extreme amount of pressure. Very uncomfortable for patients. Whereas this one is very comfortable. 5.4 patients report no discomfort at all. Okay? All right. Now, even more detail on the safety aspect of it is, during the FDA study, there were 0 unanticipated or serious device-related problems. In other words, the eyepieces did not cause any kind of serious problems for any of the patients. Okay? All right. There were a very small percentage who had a little bit of irritation just from the putting on and removing of the eyepiece. That was a very small fraction, 2.9%, and that went away without any treatment. So basically the next day everything was fine. Okay. Also, what about any types of irritation or discomfort? So we want to know, is it a painful process? So during the treatment, patients were asked, well, what's your level of discomfort? And during the time the treatment was going on, they said it was about 1.4. On a scale from 0 to 10, they said it was about 1.4, very low. Immediately after the treatment, they took the eyepiece and said, okay, what's your level of discomfort now? It was 0.2. It essentially is nothing. So we know it's a safe procedure. We know there's no pain. And also, to satisfy the FDA, they measured the eye pressure before and after, no change in pressure, just to be able to give people with glaucoma reassurance it's not going to affect their glaucoma treatment. And nobody lost any vision from the treatment. So, in fact, in our experience, patients actually improve their vision because the surface now is not as dry. Okay? So what can we expect from the LipiFlow treatment? So again, the number of glands that you have before the treatment should increase from 2 to 3 times after the treatment is done, because it removes all the sludge. Now the tears can get through. Okay? Most patients start feeling better after a couple weeks. It gets better 3 weeks, better 4 weeks. And obviously the patients who have less severe scarring are going to improve quicker and get a better result than the patients who've had a lot of scarring, who've been suffering this for many years. Now, a key thing I want to emphasize at the bottom where it says, even after we do LipiFlow, it still requires ongoing maintenance. Because remember we said the 3 things that cause the dryness, right? One is the blockages. That's what the LipiFlow is for. The other is inflammation. The other is bad blinks. So you still have to continue to be aware of those other two factors. Okay? All right. So what are the most common questions? Again, what's the goal of LipiFlow? The purpose, again, is to remove all the blockages so the tears can flow onto your eye. Okay? Does it hurt? No, absolutely not. We know it's not painful whatsoever. I've had the treatment done myself. No discomfort. It's kind of an odd sensation, but no pain or discomfort at all. How long does the treatment last? So typically, there was a follow-up study to the group that had the original FDA, the original FDA study group, and what they found was after 3 years, 85% of the people did not need another treatment. Now, in our experience here, we're finding about the same. Somewhere between 3 to 5 years, a patient may need another treatment, but many don't. Okay? Is it safe? We already established a very safe procedure. Who's a good candidate? So anybody who's got basically dry eye because of blockages in the lid, but still has good viable glands, is going to be a good candidate for the procedure. Okay? So what's the follow-up? So we do the treatment. We typically see a patient for their follow-up about a month later, and then we get a better idea of what your final outcome is going to be. Can I stop other treatments after doing LipiFlow? No. Again, we still need to control the inflammation, so you'll still be on the Restasis or Xiidra or some other type of anti-inflammatory drop. You'll still be taking omega-3s to reduce the inflammation. You'll still be doing the warming and the lid cleaning, and you'll still be doing your blinking exercises. Okay? Can we do it at any of the clinics? At this time, the only clinic that has the LipiFlow treatment is here at the Huebner Clinic. We are going to be getting that set up in the next couple weeks at the Westover Hills office as well. Okay? All right. So one of the things I kind of mentioned on earlier, and we'll talk a little bit more about, is what's a covered versus non-covered service. In other words, what does your insurance cover? What does it not cover? Now, of course, medical insurance never covers everything. It's kind of like dental insurance. It covers some basic stuff, but if you need more intensive treatment, it's not covered. Also, medical insurance doesn't cover hearing aids, doesn't cover genetic testing. There's a lot of stuff that's not covered by medical insurance. Generally, we try to do as much as we can within what's covered by insurance first, and that's what's called the standard of care. The standard of care might have skipped one. Here we go. The standard of care is a legal term that means how would most doctors in that community treat that medical problem. Okay? So the standard of care for treating dry eyes is the warming, the lid cleaning, the Restasis or Xiidra, the punctal plugs, and that's about it. Well, that to us is not sufficient. We know there are other treatments that are highly beneficial to patients. Some are covered, some are not. So on the little graph here, we have below the line what's the standard stuff that's done in the community and what we do at MCOA. So in addition to what the standard, we also, of course, do the LipiView and the LipiFlow treatments, the Procera, the Regenerize, the Oxervate, those new medicines we talked about. We do the Blefex to remove all the crust off the lids. So there's a lot of other treatments that we offer here beyond what the standard of care is. Okay? So we're going to skip this slide. This is basically just pointing out that there's about anywhere from $1,000 to $2,000 a year of expense that patients with dry eyes incur. It's a very expensive condition to have. By the time you pay for all the meds and the drops and the ointments, it can really add up. So one of the key points that I want to, again, emphasize is the three main things that cause the dryness. Once again, not making full and frequent blinks, clogs in the tear ducts, and the inflammation. So what do we want to do again? Do your blinking exercises, take the omega-3s and the Restasis or Xiidra anti-inflammatory drops, and then do the any of the biologicals to heal the dead skin, the Procera, the Oxervate, the Regenerize to heal the dead skin, and then ultimately the Blefex and LipiFlow to clear the sludge so the tears can flow freely onto the eye. So this kind of summarizes how this looks from a patient standpoint. So step one, it says on your left is just your basic eye exam. So when you come in for your regular eye exam, the doctor's checking for a variety of general things, cataracts, glaucoma, macular degeneration, various things. We also look at the surface of the eye to see if it looks very dry, but that does not give us great detail or diagnostic analysis of the tear film. For that, we have patients come back and do a specific, what's called dry eye evaluation. And again, that's where we look at the eye without any other drops being added in to see the surface quality, measure your blinks, measure the tear film, look at the tear glands in the lid. We can even take pictures of those tear glands to see what their condition is. Okay, and at that stage, beyond just the warm compress in the blinking, etc., we'll often start patients on either punctal plugs or an antibiotic steroid drop, and then transition to the Restasis or Xiidra. So that's kind of step 2 when we actually start to delve more into detail in treating the dry eyes. Now, then we reevaluate the patient again, usually a month or so later, see how they're doing. If they're still dry, then we start talking about some of the biologicals. Again, the Procura lens, the Regenerize, the serum tears, those types of things to heal any dead skin that's refusing to smooth out. Okay? And then after that's taken care of, if they're still dry, then we say, okay, we've exhausted all these other treatments, let's do the BlephX and LipiFlow to clear the sludge out so the tears can flow onto your eye. Okay? I do want to go back to this one. So we talked about some procedures being covered by insurance and some not being covered. So what are the fees we're talking about? So again, the Regenerize, as I said, that's the liquid version of the Procura amniotic membrane. Runs about $175 a month, and then it goes down after 2 months. Okay. The other one that's not covered by insurance is the BlephX. That's the one that polishes away all the dead skin off the edges of the lids. That's $250 to do all 4 lids. And then lastly is the LipiFlow. That's the one we saw the video where it does the warming and massaging to extract all the sludge. And that one is $500 per eye or $1,000 to do both eyes. Okay. So I think that pretty much will kind of bring us up to speed, right? Are you jumping forward? Yeah. Good. All right. So again, just to kind of put this all into perspective, I do want to run that video in case you missed it earlier. Now that I've kind of made you aware of what to look for, pay attention again to the nice full blinks, the nice healthy looking eyelid, that nice oil layer on the front surface of the eye, and of course the eye itself is nice and clear and healthy. So that's our goal. That's what we're working towards, and fortunately we have many, many good treatments available to accomplish that. Okay. We've taken a few questions. We have one more. Okay, great.
Somebody asked, can any of these treatments be permanent?
Okay, so the answer is most of these treatments are going to last for a certain duration period of time. For example, the Procura I mentioned can last for several months, even up to a year, and can be repeated. When we repeat it lasts longer and longer. I do have some patients who were severe, and now we may do the Procura once every year, whereas initially we might have done it 2 or 3 times during the first year. Okay. The BlephX, again, is the polishing of the lids. That generally lasts about 6 months, depending on how well the patient keeps it clean. I tell patients it's kind of like going to your dentist. They polish all the tartar off, and but if you don't brush, you're going to be back with more crud on there. The more you keep it clean, the less they'll have to polish away. It's the same thing with your lids, depending on how clean you keep the lids. The LipiFlow, again, as I said, most of the patients do well. Anywhere from 3 to 5 years later may need another treatment, but I have many who've had one treatment 5-6 years ago, and most of them still haven't had a second treatment done. Okay? So it depends also on this, and that is each patient is dynamic. They're constantly changing. For example, we have patients who have quite a bit of dry eyes. They may work here at USAA, and then they come in, they say, hey, my dry eyes are doing great. I say, okay, what's different? They say, oh, I retired. So they're not looking at the computer 8 or 10 hours constantly. Or they say, hey, I did have quite a bit of extra weight. I got healthy, I'm exercising, I'm not on my high blood pressure medicine anymore, so my eyes are not as dry. So there's other factors that come into play. And conversely, we can have a patient who may have been doing okay, but unfortunately then later on develop some other serious health issue, for example, cancer, and they're taking chemotherapy that devastates the tear glands, which can make it a lot worse. So there's other dynamics that come into play. What we talked about today is more in general terms. All right. Other questions? Good. Okay. All right. So I think we're going to do a drawing. No, we're not. Okay. So I do have one last thing, and that is please share this with friends and family. We used to do these in person. Now we're just doing them obviously remotely until it's safe to have people come back in person again. But in the meantime, please, I encourage you to share this. I do this because I want the knowledge to be given to you that you can share with other people. So please feel free to call or let us know if you have other questions or concerns. Otherwise, thank you again for joining me. Bye. Good night.